Backlash over the country's response to Ebola is leading President Obama to consider it a so-called czar. That person would oversee efforts to contain the virus. Until now, some reporters wondered who's in charge.
So the point is,
you're interrupting me because you feel like you have a point to make, but you understand my question.
well, no, I think the point that I have to make is directly relevant.
You seem to be reluctant to say who's in charge of the federal response to Ebola.
Jim, I think that I'm reciting very clearly to you who specifically is responsible for which activities when it comes to this government's tenacious response to Ebola. So
there's not one person in charge.
I think that there are individuals who are directly responsible for their line of responsibility.
Our Dr. David Agus is here. Good morning. You can understand why there's so much confusion here about who's in charge. Why don't we know at this point?
Well, it's a very difficult question. You know, the CDC is supposedly in charge, but they have no authority over individual hospitals. There are 5,000 hospitals and 2,500 public health departments in the country. And our country's constitution says states are in charge of health, not the federal government.
So do we need a czar?
You know, Obama for days said, we don't need a czar, there's no need. Now, all of a sudden, the tune is changing. And I think we do. You know, we're getting such mixed messages. There was new data that came out last night showing that at 21 days, when we said the incubation period is over, you're free, 12% of people, up to 12%, can actually still have symptoms after 21 days. So we're told one thing, and then the data are showing another. We're told as if it's black and white, and most of the time, it's not clear data. So we need real leadership to get behavior change.
And we know Amber Vincent, the nurse who traveled from Texas to Ohio, may have been ill. She reported the fever to the CDC. It was only 99.5. Now you have schools in Ohio and Texas shut down. You have the crews that were on board those planes. They have 3 weeks of paid leave. Do you think that's prudent or unnecessary panic?
You know, I think this is way overblown in many sense, is that the relative risk to each of us is near zero. The risk of us getting the flu is thousands of fold higher than this, obviously. In a good year, 3,000 people die from the flu. In a bad year, 50,000 people. And obviously, single digits have died from Ebola. That being said, because of the indecision, because nobody really knows what information is real and they're told different things every day, it creates enormous stress. It's similar to the anthrax scare after 9/11, where nobody knew what was going on and there was tremendous stress across the country.
Okay, but in terms of Ebola, it's not new. Why do we know so little? And why is there so much confusion over days and when it's okay to travel and all of that?
Well, it's new to our country. And so it was in Africa. It would hit a village, and the village was small, and it would wipe out the village. Now Africa's urbanized, so it hit a city, and pow. And this is really the first time we're seeing it grow exponentially. And at the same time, viruses change. And so the virus of today is different than the virus of last year, is different than the virus of last month even. And so the virus has always changed. We're slowly learning about these. This is new science. This needs leadership to calm the country and at the same time develop a plan so that we're not all going to be in trouble here, and take care of Africa, because at the rate of growth in Africa, it's going to be 1 million deaths by the end of January if it doesn't stop.
I think one of the things that's so stunning is we feel like we're unprepared, even though, as Charlie said, this isn't new. And we know these 2 nurses have been moved to these kind of high-risk decontamination units, but there's not enough of these units across the country. Is that the problem?
Well, there are 4 of these units with about 20 beds. That is nothing. You know, I'm at one of the largest hospitals in the country, and to prepare for Ebola, I got an email. You know, this is what you need to do. Well, obviously, I'm not going to be in the front lines of it as a cancer doctor, but we need to start to train many centers across the country to handle a larger volume of patients, because we're all scared. We're told every hospital can handle it. And then we're seeing these nurses flown to Georgia, flown to Washington, because obviously they couldn't handle it in Dallas, one of the biggest cities in the country.
Unbelievable. Thanks, Dr. Agus. Great to talk to you this morning.